top 9 warning signs of blood clots to be aware of. In this video, we'll go over 9 warning signs and symptoms that could mean you have dangerous blood clots in your body. Your body naturally creates blood clots and gets rid of them throughout the day. But sometimes, if they don't go away like they should, they can get stuck in your arteries or veins. This can stop the blood from flowing to and from your heart, and that's really not good. It can lead to serious problems like a heart attack, stroke, or something called an embolism. An embolism is when a blood clot breaks off and gets stuck in your lungs. If you notice any of the things we talk about in this video, it's super important to get help from a doctor right away. Remember, this video is for educational purposes only, and you should consult your doctor if you have any medical concerns. Number 1. Walking cramps, also known as claudication. Sometimes, harmful blood clots can form in the veins or arteries of your legs or arms. This can be more likely if you smoke, are overweight, or have diabetes. If you feel a cramp-like pain in your leg muscles when you walk, and the pain goes away when you rest, it could be because of a blood clot. These pains usually happen after you walk the same distance each time and get better when you rest. You might also see your leg or arm swell up and notice that the sore spot is red and warm if there's a blood clot. Number 2. Sharp chest pain, also known as pulmonary embolism. If you suddenly feel out of breath, have sharp chest pains, or trouble breathing without a clear reason, it could be because of a blood clot in your lungs. This happens when a blood clot breaks away from a deeper blood vessel in your body and travels to your lungs, blocking the blood flow. This is really serious because it stops enough oxygen from getting into your blood. If this happens, make sure to get medical help right away. Number 3. One-sided numbness, also known as ischemic stroke. Imagine your brain is like the control center of your body, and it needs a good supply of blood and oxygen to work properly. Sometimes, a clot can block the flow of blood to your brain, causing what we call a stroke. This can happen more often in people with narrow arteries due to plaque buildup. When this occurs, you might suddenly feel like one side of your body isn't working like it should. Your face, arm, or leg might feel numb or weak. You could also have trouble speaking, understanding, or even feel dizzy. Plus, your head might hurt a lot because your brain isn't getting enough oxygen. If this ever happens, don't wait. Get help right away by going to the emergency room or calling an ambulance. Number 4. Basketball belly, also known as hepatic vein thrombosis. Blood vessels are like little highways in your body, and sometimes, clots can get stuck and block them. If these clots end up in the veins of your liver, it can make it hard for your liver to work well. This might lead to something called ascites, which makes your belly swell up and feel tight, almost like a basketball. But remember, this belly problem can also be caused by other liver issues, not just blood clots. So, it's really important to talk to a doctor to find out what's going on. Number 5. Arm pain, also known as coronary thrombosis. Your heart is a strong muscle that needs a good blood supply too. Sometimes, a clot can block a blood vessel connected to your heart, and that's when a heart attack can happen. If this occurs, you might feel really bad chest pain that can also spread to your left arm or even your right. You could also feel sick to your stomach, dizzy, and even sweaty. This is serious stuff, so if you ever feel like this, don't wait, get to the emergency room right away. If you find these tips helpful, I encourage you to show your support by liking this content, subscribing to my channel, and enabling notifications for the latest health and nutrition tips. Number 6. Loss of vision, also known as retinal vein occlusion. Picture the veins in your eyes like little pipelines that carry blood. Sometimes, a clot can clog these pipelines, which can make you wake up with vision problems in one eye. Or suddenly, your vision in that eye might get blurry. There might not be any pain with this kind of clot. You might also notice a dark spot in your vision. This is something that needs attention, because it could lead to other eye problems. Number 7. Irregular heartbeat, also known as atrial fibrillation. There's something called atrial fibrillation, which is when your heart beats too fast and in a strange pattern. This can happen because of a problem with your nervous system. When your heart doesn't beat right, blood can sometimes gather in your heart and then travel to your brain, which might cause a heart attack or stroke. It's important to keep an eye on this if you have it. Number 8. Swollen feet, also known as edema. Have you ever noticed your feet and ankles getting really puffy and your skin stretching out? If this happens and your skin looks shiny, or you can make a little dent in it when you press it, it might mean that your blood isn't moving around your feet like it should. Sometimes, this can make your risk of getting a blood clot go up. But don't worry, there are things you can do to help, like exercise, taking B vitamins, and making sure you have enough of the right minerals in your body. Number 9. Varicose veins. Varicose veins are those veins in your legs that can look kind of blue and twisted. They happen when the blood isn't flowing well and the veins lose their strength. This can be because of high levels of something called estrogen in your body. Having varicose veins can increase your chances of getting a blood clot. When blood gets stuck in those veins, it's not good. Sometimes, it could even mean there's a deeper problem called deep vein thrombosis. How to prevent blood clots? Our bodies make and break down tiny clots in our blood vessels all the time. But if you're growing older, not moving much, taking certain meds, or missing some important nutrients, you might have a higher chance of getting risky blood clots. Don't worry, we've got some important steps to keep those clots away. 1. Keep moving. If you sit for a while, like at work or on a bus, make sure to stretch and move every hour. This helps your blood flow better and makes it less likely for clots to form. Also, wearing special socks on long trips can help avoid blood from getting stuck and forming clots. 2. Serrapeptase supplement. There's a helpful stuff called serrapeptase, taken from silkworms. Taking a pill with this can make your blood thinner and break down the hard parts of clots. Just remember, talk to your doctor before trying this. 3. Healthy eating. Eat good, natural foods like veggies. Veggies with potassium and magnesium, such as broccoli, cabbage, and leafy greens, help balance the fluids in your body. 4. Healthy habits. If you smoke, try to quit. And don't have too much coffee. 2 to 3 cups a day is a good limit. Drinking enough water and adding a bit of potassium can also help your blood flow and heart health. Talk to a special kind of doctor if you're using certain hormones. 5. Blood pressure. Keep your blood pressure in check by moving around, staying calm, taking an herb called rhodiola, and eating nutritional yeast for vitamin B1. We hope that the information shared in this video helps you in your journey towards a healthier lifestyle. Don't forget to subscribe to our channel for more healthy food inspiration and tips. See you in the next video.